So, Miss Catherine, my name is Saad. I'm a graduate student in University of New Haven of Healthcare Administration. I did my undergraduate in dentistry in India. Then I moved to Connecticut almost a year ago. Uh, so
Awesome. Awesome. And what are you studying in your master's program right now?
I'm studying healthcare administration in my master's program right now.
Awesome. And what specifically, so I have a master's in public health, so I always like to know what people are, why they wanted to do a master's degree. So what specifically are you interested in on the administration side?
Yeah, actually, when I was doing my undergraduate, I felt, I was more inclined to the business part. I wanted to make the healthcare affordable instead of, providing direct care. So, yeah, that's why I chose, administration, yes.
I have a very similar story, but I think you have that question for our interview. So go ahead and jump in. We can start.
Yeah. So my first question is, what is your educational background?
Yes. So my educational background, I have a bachelor's in psychology and a minor in biology from Austin College, which is a small liberal arts school in the northern part of Texas. We only have 1,300 students, so we knew everybody on campus. It was awesome. And then I have a master's in public health from the University of Connecticut. I selected the University of Connecticut for a couple of reasons, but one of the main reasons is that I had a full ride, so my entire education was covered. I served as a graduate assistant in the research department, looking specifically at the perception of sugar-sweetened beverages among parents of preschool children. So bachelor's in psych and bio and a master's in public health. I also have a graduate certificate in leadership and nonprofit management. This is like a side level of courses. So.
Okay, my next question is, how did you develop your interest in healthcare? Why specifically healthcare?
This is a good question. So this is an important question, and it's always fun to hear different answers. So for me, I think it came down to the fact that, so I was in 5th grade and I broke my ankle. It was a really, really bad break. Like it was, my growth plate had fractured, which means that obviously that can affect your growth and development. And the orthopedic surgeon that I had at the time, to me, when I'm in 5th grade, saved my life because I like sports and I like to run. But he did say that I'd never be able to play soccer again, which was really sad to me. But together, we worked together. He did a great job. It actually was a non-invasive surgery. All he did was remanipulate my ankle and reset it. Had a really great physical therapist, and over time, I recovered well. And so from that time, that was in like 1995, to age myself. So I was like, I'm going to be a physician. Because when you're a kid, like the only things that you think about are things like lawyer, doctor, and teacher. You forget that there's this like massive opportunity of other things that you can do in your career. So all the way through school, I chose Austin College because of pre-med. I was pre-med all the way through my senior year in college and had always just had this desire for healthcare. For some reason, I've personally loved hospitals. It sounds really weird, but I always wanted to work in a hospital. I always wanted to be inside hospitals and volunteering in hospitals. But the switch to wanting to do administration, or kind of looking at a denominator of millions and billions as opposed to one at a time, very similar to what you just said. I was doing clinical rotations in Ecuador, in Quito, Ecuador, and Puyo, which is in the rainforest. And even though everything was in Spanish, I was actually really bored with it. And I was like, well, I don't really like the clinical side of it because every single thing is the same every day. And it was at that point I decided that I'm more interested in the administration of healthcare, dropping costs in healthcare and driving towards change in a denominator of millions.
So as far as I know, you are the administrator in Yale New Haven Health, right?
Yeah, I'm a former hospital administrator there. Yep.
Okay, so when did you decide to become a leader instead of administration?
Like an entrepreneur of a company? Yeah, so that's another good story. Okay, so I'll preface by Yale New Haven Hospital and Health is a great place to work, but there are certain personalities that thrive better in an entrepreneurial environment, or environment that you can just kind of grow a little bit faster. So I actually attribute my entrepreneurial jump to Yale New Haven. I started there in May of 2014, and I started in the strategic planning department, which basically means we did market and business assessments to grow market share. So a lot of people forget that healthcare is a business, and you have teams that analyze data to figure out how to move into different locations in different communities in healthcare. That's what I did for the entire medicine and surgery service line. Within 6 months, I mastered all of our tools in the department. I mastered all of our analytics. I rebuilt a lot of our dashboards, and just kept asking for what's more, what else can I do? And it became pretty clear that there is not really a way to go up from there. And I had a 2-hour commute. So 1 hour there and 1 hour back, because I live in the Hartford area and you're in New Haven. So you know that commute. And I did a lot of reflective thinking and realized that the times that I was most satisfied in my career and life, I was very entrepreneurial in nature. So very autonomous, leading a group of people. And so I decided after lots of thinking that the entrepreneurial journey was best for me.
Okay. And what are the main differences you feel right now? Difference between being an entrepreneur and being an administrator?
Yeah, this is a big one. So vacation days. Being able to step away. My being able to leave your work at work, to be honest. And I know there are a lot of administrators that don't do that. And I worked very long hours at Yale as well, but it's nothing like being an entrepreneur. So I'm usually up every day at 3:30. I don't go to 3:30 a.m. I don't go to bed until 9:30 or 10:30. And there's so much that needs to be done. And you always feel like you're not done with your work. And again, not that you don't have that same feeling in a non-entrepreneurial job, but it's just a little bit different when you're the head of the organization, running the organization, and even with an excellent team like the team that I have, the perspective is just a little bit different. So sometimes I forget that there are holidays. So I was out to dinner with my husband a couple of weeks ago, and the waitress said, "Oh, enjoy your long holiday, your long weekend." And I was like, "Oh, right, holidays. Don't remember what that's like." So it's a totally different perspective.
Okay. And according to you, what are the current issues in healthcare that needs immediate attention right now?
Oh man. So we can talk global health, we can talk US health. But I think, so one thing that we're focused on tackling with the protocol that we're creating, the protocol is called Health Nexus. It's open source, free to use. We use a technology called blockchain, but the whole idea behind it is twofold, really, is to create applications that facilitate more efficient and secure transfer of data, or access to data. One of the biggest issues in healthcare is the physical transfer of data. People don't like to actually move data, but with our protocol, you can just govern access to it and analyze the data. So it kind of reduces the barriers. But then also, because the protocol is open source, anybody can build blockchain applications. So it kind of opens up this opportunity to really focus on opening up access to data, which gets us to value-based care, which is something that I'm personally really passionate about. I think it makes a lot of sense to, if done right, tie out reimbursement to outcomes. So I think this issue around moving data around and having access to data in a timely manner, but actionable data, I think is a big issue. And there's a lot that stems from that, a lot of other smaller issues. But that's something that we're really passionate about specifically.
Okay. And where do you see US healthcare system in next 10 years?
Oh boy. So the US healthcare system, I personally think we're moving in the right direction. Again, I'm a pretty strong proponent of value-based care if it's done correctly and structured the right way. Specifically, I really like what's called a bundled payment, which is capped reimbursement, as opposed to something like population health, which is great in theory, but the locus of control is a lot harder, whereas bundled payments are pretty focused, and the locus of control is with the provider. So in the next 10 years, if we continue on this value-based care track, or just something in general around the extreme focus around improving care while decreasing cost, I think we're going to continue to move forward in that direction. One of the things that doesn't get in the news is that we have actually been quite successful in reducing variability, which means streamlining care and improving outcomes and reducing cost. There's a lot more that we need to do in that arena. And in the next 10 years, I look forward to leaders like you in administration who create programs that really drive us towards decreasing cost and improving patient care. So I think we'll get there. I think we'll see a much more efficient healthcare system. I think we'll see a healthcare system that's driven by effective technology. And I think we'll see a healthcare system that overall is less expensive with better outcomes.
Okay, and my next question is, if you can start everything from your college, would it be the same path for you, or you would like to change something?
I ask myself this every day. It's a really good question. So, okay. I wouldn't change the pathway because everything that I did, makes me a better leader, and I'm still like, there's still a lot of room to grow. There's still a lot of opportunity to improve as a leader. You should always be learning and improving. But everything from Teach for America, where I was exposed to really outstanding strategic planning, backwards planning, data analytics, to my master's in public health at UConn, which was covered. Having a free ride to a graduate program helps you significantly financially, but then also gave me really good exposure to data analytics and the research side. So I think that I'm grateful for the pathway that it took. But I do wish that I had latched on to the entrepreneurial journey earlier. The older you get, the harder it is to start a company. I don't have kids yet, but I am married, and the balance is really, really hard. The best time to start a company is right out of college. It seems scary financially, or like your mid-20s once you've had like financial cushion, you've been out in the real world and experienced a couple of things. But the earlier you can start a company, personally, I think it's better, just because your risk is lower. There's always a lot of risk in starting a company. But I always reflect, what would have been different, or, would it have been a lot different if I had started earlier? So.
And what advice you would like to give to young professionals like me?
So some of the advice that I wish that I had gotten is, and it's not, I don't know if it's advice or if it's more just like connections and networking. Don't underestimate the power of networking and exposing yourself to a lot of different opportunities and career pathways. So in the United States specifically, I feel like we're kind of put on this very specific track of careers and career finding. And, you can be a physician, you can be a physician leader, or, there's administration in healthcare, and there's hospital administration. But my advice would be to find as many ways as possible to expose yourself to as many career pathways as possible. There's a lot that you can do in healthcare administration. There's so much in the government sector, in the private sector, in the combination of the two of them. So my suggestion would be, as early as possible, get exposure to as much as possible, every single opportunity that you can do with your degree.
And my last question is, what is a typical day for you, or typical week?
So that's one of the things that I love about being an entrepreneur is no one day is the same. So I could take you through today, for example. So today I started at 3:30 a.m. with no alarm. I usually don't need an alarm to wake up because my brain wakes me up. And I usually start first with some sort of meditation, usually 10 to 15 minutes of meditation. I make the bed every single morning. It's a habit that I learned there's some Marine guy that he wrote a book on make your bed. And basically, once you make your bed, even if your day falls apart, you can point to that one thing that you did and you're like, at least I did that. So I make my bed every morning. And then I usually dive into, first I start with easy tasks. This is actually not what people say you're supposed to do. I start with the easy task because I'm an achiever. So I like to feel some sense of gratification. And then I usually tackle the hardest tasks. I have my calendar blocked so that I don't have any meetings before 10 a.m. So I usually have between 3:30 and 4:30 a.m. until 10 with no distractions and no interruptions. It allows me to focus and kind of nail down the things that need to get done. Anything after 10 a.m. is totally up in the air. I have no idea what happens. Usually is totally unpredictable. Fires here and there, different phone calls that come in or get canceled. And so, morning time is very focused and reflective. Afternoon time is spent often on the phone, growing our community and growing connections with others in healthcare.
Okay, so that was my last question. So I would like to thank you very much for giving your time and giving me this opportunity.
Thank you. I really appreciate it. Those are great questions.